Well, thanks for that introduction. I'm really excited to be here and sad that I'm not going to be able to spend the full day with you. But data is important to us, and it's going to help us move towards oral health for all, but also towards health for all. And nowhere is this more apparent than in the key priorities from our new NIH director. Her name is Monica Bertinoli, and she began earlier this year, as you know. And among her key priorities are ensuring that clinical trials yield the best results and are representative of diversity of all people. Of course, there'll be data coming in from those trials. And secondly, to embrace the rapid expansion of data and analytics tools, recognizing that we can use this data to help us advance care, okay? So being able to collect this data in a responsible manner, making sure that it's fair, that it adheres to all of the principles for maximal reuse is going to help us to really advance things in the way that we haven't done before. And the other thing is making sure that the data really looks like the country will help us with restoring trust in science by making the data and the results accessible to all communities, and will also inspire the next generation. So, you know, there's lots of challenges in data science, and many of them have been addressed and are being surmounted in the context of FaceBase, right? We need fair data. We need to have sharing and integration of results. We need to make sure that it's going to be sustainable and also cost effective, okay? We can't put stuff in glacial storage and then try to retreat. It's too expensive, right? And we've got to make sure we're able to protect the privacy of everyone and reduce bias. So as we look at the strategic plan for data science that just came out this year, there's a focus on ensuring we'll have sustainable capabilities around data management and sharing. And we'll hear more about that from Elisa and her group later this afternoon. Making sure that there are programs to enhance human-derived data for research, but also data across different species, like what's happening here in FaceBase, and also happening in the Comparative Genomics Repository, which is a cross-NIH effort that began in 2019. There's got to be new opportunities for computational methods and artificial intelligence, as well as a federated biomedical research infrastructure, which I do think speaks to the hybrid that's been developed here. And then, of course, to strengthen the broad community in data science, and that's what FaceBase has been doing for the dental, oral, and facial community. So, Axel Wiesel, who is here, helped to spearhead a working group for the data science strategy for NIDCR, and that was presented at January's council. And the focus there, and some of you were on that, and I thank you for your service to the group, for any of you who participated, but critical to make sure that we got a data infrastructure tailored for DOC research, okay? And the bones of that is here in FaceBase, to make sure that we modernize our ecosystems, that there's data management, that we're thinking about those people who are going to come behind us in really building their workforce development and their appropriate training, but also make sure that we're building something that's going to be sustainable and that we're good stewards for. And if we look at what our strategic plan is, there is no place among the 5 elements where data is not important, right? We need to work towards whole person health, integrating oral health with general health. How does that occur? In the context of data, merged records, for example, and data that come from medical, dental records, as well as social determinants of health, will be really critical for that integration. Partnering and collaborating, and we saw that in Yang's last slide as we look at how craniofacial affects many other institutes and interests. And so we're so happy that those collaborations are moving towards firming up. As we move towards this precision dental medicine and what's going to be important for each individual, data is going to be critical to figure out what those algorithms are going to look like so that we can have clear signatures that are associated with a particular disease phenotype or a particular person, right? Then, of course, translating and implementing, and in the training, a diverse pipeline. And if we look at what's happening, what is happening across NIDCR and what's happening as we think about data, again, it's all integrated. The key is here facilitating the discovery and application of data-driven solutions towards improving oral health for everyone. And if we improve oral health, we'll be improving overall health, right? But we've got to think about, again, those folks who are coming after us and making sure that our workforce, our DOC workforce, is diverse and looks like the population of people who share these diseases. Okay. Now, if we look at what we're actually funding in the data science space, it's quite broad, and there have been over 95 awards, and most of these projects really are focused on data reuse, okay? And as we really build the infrastructure, we'll be able to do even more of this. But you can see, while they fit into these 6 major categories of craniofacial development, caries, birth defects, cancer, and oral health in general, and of course, machine learning, you can see that there's few things that we think about in the oral health community that haven't been touched by this, okay? So it's a real significant opportunity for us, and you can see that the field is moving and employing artificial intelligence and machine learning, okay? What about oral health disparities? Data is going to help us there too. As we look at what we've done in the past, the focus has really been on short-term interventions, mostly with children who may have had caries. And oftentimes we're thinking about hard-to-reach populations who are underrepresented, and oftentimes we have very limited community participation, okay? There was a think tank that was held in 2023, last year, to help us think about what do we need to do? Where do we need to go in this space, and how can we be effective? And right up top was research networks and data repositories, because that's what's going to help us actually coordinate these studies. And it's going to be also critical to community and multi-sectoral engagement. So, of course, as we go down these points, risk factors and whole person health, again, that's medical and dental records, right? That's whole person health. Social determinants of health, social and commercial determinants of health. Also data. There's not a place here that data is not central to our being able to move forward in terms of these disparities, which remain a significant problem for our field. Okay? Along these lines, there was a concept that was cleared also last fall that's called Advancing Data and Practice Transformation for Caries Equity, okay? And this is being spearheaded by Hiroko Aida, and it's called Adapt EQ, Caries EQ. What's the problem? Again, while we've done better in terms of the last 2 decades with people getting care, that's not been true for everyone, right? So we really need to make sure that we're working towards reducing caries disparities. And we know that the prevalence of these caries is highest among children who have lower household income. So what's been proposed is to form a hub, okay, that's not only a resource consortium, but also a data hub to support community participatory approaches, which is really important. And so here, data science is going to be central to helping acquire the evidence to help us diminish oral health disparities. And right now, this is a shared effort between NIDCR, and we'll be collaborating with NIMHD. Why NIMHD? Of course, they think a lot about disparities. That's their institute. But the other thing that they've done is build the Science Collaborative for Health Disparities and Artificial Intelligence, the focus there being on diminishing bias in the analyses. And this is called SHARE, okay? And so what they've done is try to work towards making sure there's increased participation of women in underrepresented populations. They're really leveraging population science and social determinants of health and behavioral health using these cloud computing tools that can interface with what we have here at NIDCR, what we're building in terms of our data ecosystem. So there'll be opportunities for DOC researchers to utilize those cloud computing tools that will advance AI to help with bias mitigation and ethical inquiry, which is really important as we move forward towards reducing oral health disparities. Again, data management and sharing is critical, and the policy is going to apply to all NIDCR and all NIH research actually results in the generation of data, which is everything that we do, right? And so the focus here is to enhance stewardship and transparency, advance rigorous and reproducible research, which is something we've worked hard with here at FaceBase, particularly starting on the front end with the data, helping people to self-curate their data and make sure that it'll be ML and AI ready. And then, of course, this will enable in-depth data-driven discoveries that we didn't have before. So I applaud you, FaceBase, because you have these specialized repositories. There are generalist repositories. FaceBase has now made a kind of a hybrid, kind of that sits in the middle, and this allows the flexibility for many different experiment types, different types of data, and the ability to scale up. So cheers to you on your 15th anniversary here, to who you are, but really looking forward to what you can be as we think about these meaningful collaborations across other institutes. Again, you've provided this service to the community for 15 years. It's an agnostic model. You've been able to utilize data crowdsourcing and self-curation and quality control. You have pipeline automation, built-in flexibility and scalability, and the opportunity potentially to even be interoperable with the comparative genomics repository, HEAL, and others. This speaks to the potential for opportunity for data across ICs, as we saw in Yang's slide, but also across many fields. And I think that is very exciting and very important to being able to move the needle forward. So moving forward, across species, across omics, electronic health records, imaging, audio, other things I didn't think about, but will really help us because, this craniofacial is part of the rest of the body. And you think about the syndromes and the systemic complications of people who have craniofacial disorders. And the opportunity for all of these data to speak to each other is incredible for who? The patient, who's a whole person. So I'm excited for today. I'm sorry I can't stay for the whole thing, but cheers to a wonderful day and a great 15 years.